Today we're going to be talking about the CynoGlow, which is essentially 2 treatments in one.
Yeah, so this is a newer procedure that we have in the clinic. It's super fun and it combines 2 things at one time. PicoSure laser targets pigmentation, discoloration, sun damage, even melasma on the skin. So that's main target is kind of resurfacing those dark spots. It can help with texture, fine lines, also kind of smoothing out the skin in a sense. So, and then we combine the microneedling.
Microneedling that we have here in office is going to be the Potenza. So we combine those 2 treatments. Microneedling is going to target fine lines, wrinkles, minimizing or reducing the appearance of the pores. It also has that radio frequency, so we are tightening the skin. We use those needles to kind of drive and penetrate deeper in the layers of the skin.
With those combined, then obviously you're getting hyperpigmentation and tightening of the skin, helping with the fine lines. So it's kind of like a do-all, like it's the 2 in 1. It's kind of what everyone wants.
So with those 2 treatments being combined, that is called that CynoGlow, and it has been very, very popular. I actually have a lot of my patients in the midst of their series right now, and they have been seeing amazing results. And I think that a lot of people do have, melasma. They have those dark spots, they have those sunspots, and targeting all that in one treatment from the surface level and then going in with the microneedling, it's just a double whammy. People love it. My patients are super, super happy. So if you're here for one treatment, you might as well do them both at one time. And you're here for kind of a end all be all in one treatment. So.
With your patients, have any of them had any feedback or any major thing they're noticing?
Yes. So I would say that a few of my patients definitely have seen that it is the firming of the skin, the tightening is it's just they're seeing, I guess, faster results. So that's been a big.
I agree. Yeah. I feel like I have a couple patients that are coming in consistently 4 to 6 weeks. And I feel like the first thing I notice after just a couple with my patients is the rejuvenation of the skin, actually. Their skin's very glowy and the appearance of their skin looks very healthy. So I feel like it's immediately just kind of transforming the look of the skin.
Yeah. And my biggest thing too is actually with pores. I know some people just can't do it. I've used all the things to kind of get rid of them, reduce them, but I can definitely say with the Pico first and then the microneedling, you are definitely seeing that is one of the biggest, the concerns that I see with my patients, that is, it's really, really minimizing, shrinking the pores, but definitely minimizing the appearance of them. And that's really huge for a lot of patients who struggle with that.
Yeah, so. I feel like that's a common thing.
Yeah, absolutely.
It's their pores. It's the thing they notice or something that bothers them when they put makeup on or something like that. So that's a big thing. I feel like to help people feel more confident. Skin laxity, as we mature, that's the big thing. So microneedling is the best for that because it's going so deep.
Yes.
And being able to tighten, even with the radio frequency.
Stimulating that collagen.
Yeah,
and just really.
How cool is that our skin, by doing that, is going to be able to make its own collagen.
Absolutely. So. And if you did not know, we stopped producing as much collagen at the age of 24. So imagine you're still pretty young and living life. That's and you don't really know. I would definitely say a lot of my patients too, the microneedling, you can get right before the soft tissue of the eye. So with that being said is that and then we can also do right up here on that brow bone. And I will say that my patient, yes, almost like an eye lift. So and then obviously those crow's feet, the crow's feet area, that is just a very stubborn area. That stuff can be hereditary. That stuff can be not enough sleep, all the things, not enough water. That can it really hinders because it's the eyes. So with the microneedling, we can get really close in there, and I do see my patients really be happy with that result right away. So skin tightening there and then firming that area, almost brightening it up.
Being able to go in there and tighten, because obviously topicals can only do so much. That thin area is going to show a lot of, wear and things like that,
Yes.
and you know, the fine lines and things like that. That's a good point with the eyes. I feel like I've noticed a lot too jawline. Like that's like the biggest thing I think of my patients is, oh my gosh, I'm seeing some sagging, some volume loss, like the neck in here. So that's an area that I feel like I'm targeting, hitting the most, going over the most.
And I think too, with that being said, is like that, you know, kind of what we call that turkey neck, that stuff can be hereditary. So it's really, really hard to find something that works. So that's why in conjunction with, you know, our Skin Medica, our neck corrector, I feel like that really, really does help in conjunction with the microneedling. And then, once you're here, you're here, and we might as well just hit it as much as we can to get those results. But I would definitely say a lot of my patients are so happy on that.
So with my experience with the Pico, which has been interesting, is I think just of all my years of like tanning and sun exposure and gosh, wear and tear on the skin, that after doing Pico, that's going to target those. So a lot of my pigmentation has been coming up to the surface. That's its job. It's a resurfacer. It's going to bring it up. So that can be some, you know, a little alarming to people, but it's doing its job actually. So I've been noticing a little bit like in the forehead region, it's a common melasma area, but pigmentation that is, you know, from the past, that all the damage is coming up now, then we got to keep hitting it to keep getting it to slough off, to get it out, to get that off. And I know you've experienced that too.
Yeah, absolutely. Yep. So mine is really like on my cheeks here, but I definitely had some same type of sunbathing, I guess. So sunbathing, and then also using the tanning beds where it was a little excessive. And now, you know, so now years later,
now we're correcting it.
Now we are correcting it. Did have a Pico before a microneedling for like a CynoGlow, and it brought up a lot of, you know, little dark spots that were kind of, I always say they're kind of hiding or hidden, you know, beneath kind of that first layer of the skin. And so we bring it up to the surface, and then we're correcting it, you know, as you go. So it really, I will say it's a journey, you know, we're all here on a different journey. We are correcting, and we are one patient at a time, just getting the results. Can't express how much CynoGlow has really, really changed the game for here at Edgebrook Dermatology. We just love it. The patients have been so happy. So I'm excited for you guys to even eventually see some CynoGlow befores and afters. I think that would be great.